Not long ago, I had a mom show up to the hospital with a 102.7 degree temperature. Her water had broken a couple days earlier at home, but she didn't come to the hospital because she wasn't having any pain or contractions. She wanted to wait at home as long as she could. She still wasn't having any contractions, but she ended up coming to the hospital because of this fever, and she also had started having constant lower abdominal pain. When she got to the hospital, her baby's heart rate was in the 180s, and normally it should be 120 to 160. She had a condition called chorioamnionitis. But this can happen even when you're in the hospital. Maybe you've been in labor, feeling pretty good all things considered, and then suddenly your doctor walks in with a serious look and says, "I'm concerned you may have chorioamnionitis." For most patients, that moment feels like the air gets sucked right out of the room. You hear the word infection, you see monitors beeping, and 100 questions hit you all at once. Today I want to take the power away from that fear, because the truth is, chorioamnionitis is a condition that sounds much scarier than it usually is, especially when it's recognized early and treated appropriately. I'm Dr. Francis, and I've been an OBGYN in private practice for over 23 years and delivered nearly 6,000 babies. I've managed chorioamnionitis countless times, and I've cared for moms and babies in every version of this situation, from the mildest cases to the rare, more serious ones. And what I want to give you today is clarity, confidence, and understanding that you deserve. So let's break this down in a way that feels human, straightforward, and reassuring. Chorioamnionitis, also called intra-amniotic infection, is one of the most common complications we see in labor and delivery. It can be stressful when you hear the word for the first time, but most cases respond beautifully to treatment, and outcomes are overwhelmingly positive, both for mom and baby. The key is knowing what it is, why it happens, how we diagnose it, how we treat it, and what it means for you going forward. And that's exactly what we're going to cover today. So let's start by simplifying the name. The word is made up of three parts: chorio, which refers to the chorion, one of the membranes around the baby; amnion, which is the amniotic sac; and itis, which means inflammation or infection. Put it together and it means an infection or inflammation of the membranes and the amniotic fluid surrounding the baby. That's it. It's not a failure on your part. It's not usually tied to anything you did or didn't do. It's simply a situation where bacteria, typically the same bacteria that normally live in the vagina, make their way upward into the uterus during labor. In almost all cases, this happens after the water breaks, especially if labor is long. The longer the membranes are ruptured, the easier it is for bacteria to travel upward. This is one of the most common questions I get as an OBGYN. Did I cause this somehow? And the answer is almost always a clear no. And here are the main reasons. Chorioamnionitis happens, one, from prolonged rupture of membranes. Once your water breaks, the protective barrier between the vagina and the uterus is gone. Even with perfect hygiene, bacteria can still move upward. The risk increases the longer the water has been broken. Under 12 hours, pretty low risk. 12 to 24 hours, a little bit higher risk. And beyond 24 hours, the risk increases substantially more. And this is why we closely monitor moms whose water has been broken for a while. Number two is long labor. The longer the labor lasts, the more exams we need to do to check dilatation and progress. And each exam is done carefully and sterilely, but each one slightly increases the chance of bacteria entering the uterus. Number three, group B strep and vaginal flora. Some bacteria normally live in the vagina, like group B strep or E. coli. These aren't harmful outside the uterus, but inside the uterus they can cause infection. 3. Group B strep and vaginal flora. Some bacteria naturally live in the vagina, like group B strep or E. coli. These aren't harmful outside the uterus, but inside the uterus they can cause infection. And 4 is young maternal age of first pregnancy. Interestingly, first-time moms and younger moms have slightly higher risk, though the reasons aren't entirely understood. And 5, use of internal monitors. Sometimes we place internal monitors during labor to check the baby's heart rate more accurately. These slightly raise the risk because they cross the membranes. You might be asking yourself, what are the signs of chorioamnionitis? Well, we diagnose chorioamnionitis based on a combination of symptoms, vital signs, and clinical findings. And here's what doctors look for. The first thing is fever. This is the biggest red flag. A fever during labor is a strong sign that something is going on, especially if the water has been broken for a while. 2, elevated maternal heart rate. If your heart rate is higher than expected, that can be a sign of infection. 3, an elevated fetal heart rate. Babies often respond to infection by speeding up their heart rate. 4, uterine tenderness. Some women feel pain when we press on their uterus, and this can be a subtle but important clue. And 5, a foul-smelling amniotic fluid. Not common, but when it happens, it's very suggestive. And 6, laboratory findings. Sometimes we'll check your white blood cell count or take a sample of the fluid after delivery to confirm the diagnosis. But you don't need all these symptoms. Often, fever plus 1 or 2 signs is enough for us to act. The diagnosis is mostly clinical. That means we use your symptoms and vital signs, not imaging or ultrasounds. Here's what usually triggers the diagnosis. A temperature of 100.4, which is 38 degrees Celsius or higher. Elevated heart rate in mom or baby. 3, uterine tenderness. And 4, ruptured membranes for a long time. If we suspect chorioamnionitis, we don't sit around and wait for labs to come back. We start treatment immediately. Timing matters, and early antibiotics prevent most complications. And this is where I really like to reassure my patients. Treatment for chorioamnionitis is straightforward, extremely effective, and begins right away. It starts with IV antibiotics. You'll receive broad-spectrum IV antibiotics, usually a combination that covers the most common bacteria. The standard treatments often include ampicillin, gentamicin, and sometimes clindamycin and azithromycin. These medications are safe in pregnancy and have been used for decades. You'll also get IV fluids and fever control. If you have a fever, we use IV fluids and medications like acetaminophen to help lower your temperature and keep you comfortable. But the main treatment is delivery. This is a big point that often worries patients, so let's talk about it clearly. You do not automatically need a C-section if you have chorioamnionitis. In fact, most patients still deliver vaginally. We only move to a C-section if your baby is in distress or labor is not progressing safely. The infection itself is not a reason for surgery. What matters is how you and the baby are responding. Usually, once antibiotics start working, labor continues just fine. I completely understand that when you're in labor, your biggest concern is always the baby. So let's talk honestly about this. Most babies born to moms with chorioamnionitis do really well, especially when the infection is caught early and treated promptly. But here's what typically happens. The baby may be monitored more closely when it's in the womb, and this means more frequent heart rate checks or continuous monitoring. And usually it's continuous monitoring. And we also keep an eye on temperature and activity. Next, the pediatric or NICU team examines the baby closely after birth. They will look for breathing issues, fever, low tone, and all these can be signs of early infection. Sometimes the babies receive antibiotics. In many hospitals, pediatricians will start preventative antibiotics if they believe the baby was exposed. This is common and very safe. And in rare cases, the baby may need time in the NICU. This is usually precautionary and not a sign of severe illness. The bottom line, most babies recover quickly and fully. Long-term complications are rare when treatment begins promptly. For moms, the biggest concern is preventing infection progressing into something systemic like sepsis. The good news is with early treatment, progression is very rare. Most moms respond quickly to antibiotics, and many feel significantly better within a few hours. After delivery, we typically continue antibiotics for 24 hours. You can still breastfeed, still hold your baby, and still do skin to skin and bond just as you normally would. Some moms feel more tired or achy during recovery, but that usually resolves quickly. Here's one of the most reassuring parts. Chorioamnionitis does not mean you'll have it again in future pregnancies. It's not a chronic condition. It's not something you carry. and it doesn't damage the uterus long term. Your future deliveries are usually no different from anyone else's. There's no 100% way to prevent it, but there are ways to reduce the risk. And one of those ways is limit the number of vaginal exams in labor. And we try to do this. We try to avoid extra checks when possible. 2, avoid unnecessary induction early in pregnancy. Sometimes induction is necessary, but the longer the labor lasts, the higher the risk. 3, treat group B strep with antibiotics. This reduces the risk of neonatal infection. And 4, use sterile techniques. Your medical team already does this, but it's part of prevention. And if you have symptoms, don't delay treatment. Early antibiotics prevent the vast majority of complications. One part of this topic that doesn't get addressed or discussed enough is the emotional impact. Moms often tell me, I feel like my body failed, or I wish I had done something differently, or they ask, was this my fault? Let me say this clearly. As someone who has cared for thousands of women, chorioamnionitis is not your fault. It doesn't mean you did anything wrong. It doesn't mean you didn't take care of yourself. It's simply a medical condition that sometimes happens during labor. You deserve compassion, reassurance, and support, not blame. After caring for moms with this condition for decades, here's what I want you to walk away with. Chorioamnionitis is common and very treatable. We know what to do, and we can act fast. Most moms and babies recover fully, and a diagnosis does not mean an automatic C-section. And you didn't cause this. Your doctor is watching out for this constantly, and also the nurses. And by the time I tell you I'm concerned, I've already formulated the plan. If you ever hear the word chorioamnionitis during labor, I want you to remember this conversation. I want you to remember that treatment is effective, outcomes are excellent, and you have a full team, your doctor, your nurses, your pediatricians, right there protecting you and your baby every step of the way. My goal isn't just to deliver healthy babies. It's to make sure you feel informed, supported, and confident during one of the most important moments of your life. Thank you for spending this time with me today. If you found this helpful, feel free to share it with someone who's expecting. And if you have questions about this or any part of your pregnancy or delivery, leave them in the comments below. I read every one of them, and I'm here to help. And there are a lot of ladies that read those comments that are here to walk you through this journey as well.